Okay, Ms. Doe, we just finished your plaque index assessment, and as we discussed, this assessment is used to see how much plaque is on your teeth and where it's located. Ms. Doe, are you familiar with the term plaque?
Yes.
Great, so in your own words, what do you think plaque is?
The white stuff on my teeth?
Yeah, so plaque is that film of bacteria that develops on the teeth, which is really important for us to remove because if it stays on the teeth, it leads to gingivitis, which is swelling of the gums, and that can cause bleeding gums. So this index that we just did is used to see how effective your oral home care routine is at removing all this bacteria from your teeth. And as we mentioned, the goal is to have less than 10%, but today we assess your levels to be at 79%. So one goal that we can set to bring this percentage down is by increasing the frequency of brushing to 2 times a day for 2 minutes. And brushing is really going to be the most effective way at reducing the amount of plaque that's on our teeth with your toothbrush. And it's really important because if it's not removed, then, as we mentioned, it will lead to gingivitis, and gingivitis can lead to periodontal disease, which we are already seeing signs of you having active periodontal disease.
What is periodontal disease?
Periodontal disease is when bacteria accumulates so much that it starts causing bone loss, and that eventually can lead to losing teeth. And unfortunately, diabetes and smoking increases your susceptibility, Ms. Doe, to periodontal disease. And unfortunately, we can't get rid of this disease once it's started, but we can definitely stop it from progressing and leading to tooth loss. So the best way that we can stop the progression is by really working on your oral routine at home, which starts with toothbrushing. So, Ms. Doe, with me, I have this model of teeth that I'm going to use to show you an effective way to do toothbrushing. So I want to show you the modified Bass technique, which is a technique that's recommended for everybody to use because it's the most effective at removing plaque. So what you're going to do is you're going to grab your toothbrush and you're going to hold your toothbrush not straight up against the teeth, but you're going to angle the toothbrush slightly up towards the gum. And once you're angled slightly towards the gum, you're going to want to use your toothbrush to do circular motions. Just like this. And then once you do the circular motions, you're going to go ahead and sweep down with your toothbrush towards the chewing surfaces of the teeth. So if you're on the top teeth, you're going to do circular motions at an angle and then sweep down. But if you're on the bottom teeth, then you're going to, again, angle towards the gum and then sweep up towards the chewing surfaces of the teeth. And then you're going to go ahead and do that on all surfaces of the teeth, circular motions, and then sweep up. The top teeth also. And then also on the insides of the teeth too. We can go ahead and do the same thing, circular motions and then up. Okay, so now, Ms. Doe, I'm going to go ahead and give you this model, and I'm going to go ask you to try the modified Bass technique and see how that works for you, okay? So go ahead, and I'm going to have you angle the toothbrush towards the gum.
Okay,
And then
angles
go
and
ahead
circles.
and sweep down towards the chewing surfaces.
Okay, sweeping
Then
down.
go ahead and repeat that towards all the teeth.
Okay, circles and sweep, circles and sweep.
That's very good, Miss Doe. Exactly right. So that's exactly how you want to do the modified Bass technique at home to really make sure that we're removing as much plaque as we can. And this is especially good to get underneath the gum, to get all the plaque that's underneath the gum. And another thing we cannot forget to do when we're brushing is to brush our tongue as well. So plaque can actually accumulate a lot on the tongue, which will lead to bad breath because this bacteria is one of the main causes of bad odor. So when we're brushing, this model doesn't have a tongue, but we can go ahead and pretend that it does. We would also want to make sure that we brush the tongue as good as we can. Okay, and then Miss Doe, do you remember for how long we want to make sure that we brush for?
2 minutes?
Yes, for 2 minutes. And what personally helps me to make sure that I'm brushing for the correct amount of time is to play a favorite song because usually it's around 2 minutes, and that helps me to make sure that I'm brushing for long enough. But Miss Doe, you can also set a timer to make sure that you're brushing for those 2 minutes.
Will it help if I get a hard bristle toothbrush?
That's a good question, Miss Doe. And even though we certainly do want to remove all the plaque that we have on our teeth, using a hard bristled toothbrush will actually cause more harm to the teeth because it leads to abrasion. These hard toothbrushes are really abrasive, so when the toothbrush actually wears away at the outer structure of the teeth called enamel because it's really, really rough on the tooth surface. And that's not good because if we lose the enamel, it causes our teeth to be more sensitive to things, especially like cold food or drink or even air if it's really sensitive. And it also increases our risk for tooth decay. And abrasion can also happen if we brush too hard as well. We definitely don't want a lot of pressure on the toothbrush either. A lot of people tend to do that and they tend to brush really, really hard and really, really dig in the toothbrush to the teeth, but we definitely don't want to do that. So the next time that you buy a toothbrush, Miss Doe, make sure that it's one that's a soft toothbrush. Definitely avoid medium or hard or even extra hard bristle brushes. Those are definitely gonna cause abrasion, and we don't want to have that happen. And the ADA recommends actually that we replace our toothbrushes every 3 to 4 months. So whenever is the next time for you to get your new toothbrush in 3 to 4 months, go ahead and try to make sure that it's a soft bristled one because that's going to be really effective at removing plaque, but it's not going to be abrasive to your tooth.
Wow, okay.
Okay, Ms. Doe, now I'm going to give you this mirror. And I'm going to have you go ahead and use this mirror and look to see where the pink stain from the plaque index is on your teeth, because that shows us where the plaque is.
Oh, wow, it's everywhere.
So if you notice, Ms. Doe, it seems that there's a lot of plaque, especially on the back teeth. And I know that you reported in your medical history that you have a lot of pain in your right hand, as well as carpal tunnel. So, Ms. Doe, does that make it harder for you to brush?
Yes, repetitive motions hurt.
Yeah, I can imagine. I really do want to suggest to help with that, getting a power toothbrush. These toothbrushes usually have a small head, so this part of the toothbrush is a lot smaller in electric toothbrushes. And what's really great about those electric toothbrushes is that they make all of the movement of the bristles electronically, so you don't have to manually manipulate the toothbrush to get those movements as we were doing with the modified bath technique. The electric toothbrush does all of those movements for you, so that all you have to do, Ms. Doe, is just make sure you angle the toothbrush towards the gum and move the toothbrush from tooth to tooth. And that's all you have to do to get the proper brushing technique with an electric toothbrush. And these toothbrushes also, they have a handle, so this part of the toothbrush, they're usually a lot thicker, and that's easier for people with arthritis and carpal tunnel pain to hold the toothbrush because of its bigger handle. So that, I think that would really, really help you to be able to brush 2 times a day for 2 minutes. I think that will really help you a lot.
Okay, I'm gonna have to get one.
So either one that you choose, Miss Doe, either using a regular toothbrush or a power toothbrush, the most important thing is using the technique that I showed you today for 2 minutes, 2 times a day. And I know that you definitely care about your oral health because if not, you wouldn't be here today. So brushing correctly is really going to help to decrease the level of plaque. And since we are already seeing periodontal disease, this is going to be the best way to stop it from progressing to tooth loss. And we can stop it from progressing, but you do have to work on it, Ms. Doe. And now you have all the knowledge to do so, so I know that in a couple of months we will definitely see progress.